Bismillahirrahmanirrahim. Me, Dr. Salman. Today, I'm going to talk about fever. Our body maintain a normal range of temperature, which is 98.6 degree Fahrenheit and 37 degrees centigrade. This whole process is controlled by hypothalamus, a tiny small part of the brain, which control the body temperature. If our body get too hot, so our hypothalamus send signals and to the body, and our body vessels are dilated, and the pores are open, and our body starts sweating and releasing the heat out of the body and maintain the normal body temperature. If we get too cold, our body is sending signal to the hypothalamus, which then in turn sends signals to the blood vessels, and our blood vessel constrict. At the same time, our body starts shaking, and due to the shaky movements, okay, of our muscles, okay, heat is being produced, and the normal temperature of the body is being maintained. So then, what is fever? When infectious agent is coming into our body, like bacteria, viruses, etc., so it start destructing the normal cells, produce an infection. Any such activity which is abnormal activity in our body, even sometime in cancer, okay, our body temperature get raised. Due to the high temperature, the pathogen which is inside our body, like viruses, bacteria, okay, their growth stops because they need a specific temperature for its replication, and that replication process is being stopped due to the body high temperature. At the same time, the cells which are rapidly multiplying, okay, their multiplication also stops. In this way, the duplication process of the viruses at the same time also stops. High temperature, due to the immune response in our body, the pyogens are being released, and these pyogens, heat shock protein, are released in our body. And so these heat shock protein make the immune cells like lymphocytes activate them, and they are being and make them sticky, and they are attached to the endothelial cells of the blood vessel, and they are being released at the site of infection. And there they start fighting with the infectious agents. So in this way, our body fights, and it prevents, and this is the role of the fever or high temperature of our body. If it is more than 1 or 2.2 degree Fahrenheit, so it is called high grade fever. Sometime when the fever is increasing above 104 and 105, during this process, our organs are being damaged. What happens that the patient feel confused. Sometimes patients are having seizures, fits. Sometimes there is a permanent damage to the brain tissue. In that case, it is up to the doctor. He will decide according to the age of the patient, the comorbidity, and ongoing infection. The doctor will decide that whether he has to suppress this fever. Surely the doctor will give treatment for the disease. But about the pyrexia, about the fever, it is your and the doctor combined decision that he's going to reduce it immediately or give some time. In that case, the doctor will advise you to take plenty of fluid. So this is a little bit. This was about the fever. That's all. Please subscribe, like, and share my channel. Thanks a lot. That's all for today. Wassalam.